So many common football injuries that we see, especially at the high school, college, and even professional level, it's rarely a large rotator cuff tear because these are young athletes. Most of these athletes are under the age of 40. So most of the time the injuries you're seeing are injuries where the bicep attaches into the shoulder, what we more commonly call slap tears in the shoulder. And then just due to the high nature and high velocity of the collisions that they have in football, many times you're also dealing with shoulder dislocations when you end up tearing the front of the labrum, what we call the anterior labrum, or a Bankart tear. So if people do suffer a shoulder dislocation and they tear the anterior labrum, we usually call it like the anterior inferior labrum. It usually tears from, if you think of the labrum like a clock face, anywhere from like 2 o'clock to 6 o'clock or 2 o'clock to 7 o'clock. Most of the time, if you're playing contact sports, it causes you to have shoulder instability once that tears, so you have to fix that. We end up fixing that arthroscopically. It's two small incisions in the front of the shoulder, 2 small incisions in the back of the shoulder, and you end up tightening up the labrum or repairing the labrum back to the bone. And in essence, you're also tightening up the shoulder capsule. So now where the shoulder used to be loose and would dislocate, now it's tight, so you can return back to playing. So the recovery time after you have a shoulder stabilization procedure or a Bankart repair, it's roughly about average, you would say about 4 to 6 months. These are usually younger athletic patients. So most of the time by 4 months, I'm clearing them to return to contact sports. Most of the time, if you suffer a shoulder dislocation to the point where you have to have surgery, that is a season-ending injury, just due to the fact by the time you have the surgery and rehab, it's about a 4-month time period, and that's just to get you back to baseline. Then we have to get you back to playing shape. So it unfortunately, usually is a season-ending injury, but people usually do very well and can come back to this and compete at a high level. So most of the time, we used to think if you dislocated your shoulder and you had to have a labral repair to stabilize your shoulder, we used to think that would cause significant arthritic changes moving in the future. The studies show that's actually not true. How we do things now arthroscopically has shown that there's not an increase of arthritis in someone's shoulder after you have a stabilization procedure. And some of the studies have shown that there's actually worse effects if you don't have the surgery because you end up with an unstable shoulder, which can lead to further problems down the road. So you're better off getting it fixed so you don't have these issues.